Hello, everybody. Welcome to week 12 and 13 of the semester. Over the next 2 weeks, you're going to learn how to critically appraise peer review articles, particularly those dealing with therapeutic modalities using strength of recommendation taxonomy, better known as the SORT. Again, the overall purpose of this unit is to provide you, the students, the tools and the understanding to critically appraise peer-reviewed articles, particularly those dealing with therapeutic modalities, using the SORT to improve patient care based on evidence-based practice approach. You remember a few weeks ago that I sent out a needs analysis questionnaire looking at what you know about evidence-based medicine, what you know about performing critical appraisals, and whether or not you use the SORT. Stop the screencast at this time and try to reflect on the answers that you turned in a few weeks ago based on these questions. Now that you reflect on them, what I found out from the questionnaire, the needs analysis, is that a majority of you have never critically appraised a peer review article. You're not familiar with the SORT or the strength of recommendation taxonomy, and also that you don't know how critically appraising the literature works into evidence-based medicine practice. So what I'm going to do is show a short video trying to tie in those two things.
This is George. George is here to talk about the concept of evidence-based research and practice, including what that means and why it's important to understand as a future healthcare professional. Let's start with a definition. Evidence-based practice involves integrating the best research evidence with expertise and patient values. This is one of the more common definitions, but basically evidence-based practice involves combining your own knowledge and the patient's condition with existing research to make decisions. If George told his patient he was going to use a new technique to provide oxygen to his asthma patient, and not to worry, he saw it done on YouTube, the patient might not react well. However, while showing a demonstration on YouTube might be useful to the patient, George might also want to cite some examples of the technique used with other patients and the successes or possible risks associated within those examples. In this way, George is bringing in outside information as evidence to aid in decision making. So that all sounds great, but what type of evidence is best? Where do we find this evidence, and does it always exist? These are questions that we will explore further, and you will continue to explore throughout your education. But in the meantime, let's start with this pyramid. This image is often used to demonstrate the various research designs behind published research and the types of sources you will encounter as you search for information. The pyramid shape is used because as you move up toward the top, the research becomes higher in quality, but the quantity of the research becomes smaller. For example, a systematic review at the top of the pyramid is when an author seeks all the research on one topic and combines it into a single analysis. This is considered the highest level of evidence, but they are also time-intensive and rigorous to complete. Therefore, you will find less of them when searching. Ideally, you want to find research that fits into categories at the top of the pyramid, but depending on your research topic, the only research available may be case studies, or in some cases, available information might not even be professionally published. In summary, evidence-based practice means you are bringing in outside information to guide decision-making. In actual practice, you'll find decisions include many factors, including patient beliefs and current knowledge, and practice among your colleagues. But consulting outside sources of information is also crucial to making reasoned decisions.
Now what I would like you to do is to grab a piece of paper and answer the two questions that I have in front of you. These questions are based on the video that you just saw. So stop the screencast and please answer those questions. Now that you've answered those questions, let's see if we've come up with the same answer. First, what is evidence-based medicine practice? It is integrating the best research with your expertise and the patient values and designing a treatment intervention meeting the goals and desires of the patient. What is the highest level that you should use? Well, the highest level of evidence that you should use is systematic reviews, because the author of those articles has already done the research for you, say on hamstring injuries, gathered all the different studies that have been done on hamstring injuries, on how to treat them, and did a meta-analysis, and based on that meta-analysis makes recommendations, strong recommendations, on the type of treatment intervention that you should use for the treatment of hamstrings. So, what are we supposed to get out of this screencast today? Well, by the time we're done with this screencast, you, the student, should one, have an understanding the importance of critically appraising peer-reviewed articles related to the evidence-based practice medicine and its implications for healthcare providers. And two, you should be able to summarize the SORT in its application for critically appraising peer-reviewed articles and how it integrates with evidence-based medicine. Well, what is critical appraisal? It is a systematic process. It judges the trustworthiness of the research study. It judges the value and the relevance of the research study. Essentially, it's the process of putting research into practice. And that's where we get evidence-based medicine or practice, where we take good, high-level research, the control studies, the systematic reviews, and putting it into practice. And I'll be explaining that more later in the screencast. We're also looking at the methodology. Was it sound? Was it valid? The type of data collection, the analysis methods, the type of statistics that was used. All that goes into, and more, critically appraising an article. And in the end, based on how you answered those questions, we determine whether or not we can use that information in our practice. What I would like you to do now, after seeing the short video and getting some information on what critically appraising a peer review article entails, what I would like you to do is to list 2 to 3 reasons why we should do that. Well, now I hope that you've wrote down 1, that it's to facilitate evidence-based practice. That's the essence of why we critically appraise. 2, it allows us to distinguish the best available evidence. It allows us to distinguish what is good research and what is bad research. And from there, we go into best evidence approach, which allows us to retrieve reliable and updated information, because we don't want to use information or treatments that were done 10 to 15 years ago. And most of all, we want to be able to look at the literature, to appraise it, find out that it's trustworthy, and feel confident in your treatment intervention with your patient. And it also allows your patient to be confident in you, the healthcare provider, that you're using the best information to treat them. Again, the importance of understanding the level of evidence comes into critically appraising the literature, because at the bottom of that level, as we'll find out, is expert opinions. Then we have case reports, and then it goes up to systematic reviews, as it was pointed out. But the systematic reviews are important because that's where recommendations for guidelines come, as well as position statements, such as the NATA position statement on treatment of heat illnesses or treatment of concussions. And we will see how this level of evidence plays into critically appraising journal articles. There's many types of tools out there for doing it. And one here is the Oxford Center of Levels of Evidence, which is basically a 5-category level, which at the bottom is your expert opinions, and at the top, 1A is your systematic reviews. You can find handouts and more information pertaining to the Oxford Center of Levels of Evidence at the website below. On the right, which is what we'll be talking about for the rest of this screencast, is the strength of recommendation taxonomy sort. And it consists of 2 areas. First, we grade individual studies. And here we only use 3 levels as compared to the Oxford, which uses 5. We use 3, 2, 1, 1 being the highest. And then we have our recommendations, which comes out of like the systematic reviews. And I will get into more of that shortly. The strength of recommendation taxonomy started or was found by Ebel, who published it in the American Family Physician Journal back in 2004. And as I pointed out, it consists of 2 parts. It has the level of evidence for individual studies, and then it has the strength of the recommendation, which comes out of the levels. And the other thing we need to make sure is the consistent research or inconsistencies. We want consistent research when we look at the articles. To determine the individual level of evidence, there's an algorithm that Ebel published, and it's very straightforward. And you start with, is the study a key citation for the important point of evidence under discussion? If it's yes, you continue down. If no, you go off. And as you branch off with the no's, you see here there's no level. Here we have level 3, which was expert opinion or case studies. And then when you get down to this big box, we either have level 1 evidence or level 2. And here are the things that you are looking at within that study. 1, if it was a systematic review, then it's a very good chance that it'll be a level 1. If it's a randomized controlled trial, then we look at how the groups were separated. Were they adequate size of each group? Was the study powered enough? And I will get into more of the questions that we need to look at here shortly. The questions that we look at asking when we're doing an individual study are: 1, we look at the introduction. Next, we look, does the article attempt to answer the same question that we're asking? Next, is it recent? We want something within 5 years. We don't want to look at an article that's outdated. Is the article from a peer-reviewed journal, such as the Journal of Athletic Training or JOPES? Next, was there a hypothesis presented? Then we look at the methods that were used. Were they valid methods? The intervention. Next is the articles talk about how subjects were included or excluded. That's important to know. Was there a certain, in the selection, did the authors talk about controlling bias, such as having all male versus female, or more of one age than another age. Because typically in a study, we want to be able to take those results and use it to the normal population. But to have that, the study has to have a good mixture of subjects. Again, methodological protocols. Was there blinding in the randomization of the groups? Next, did they control for confounding variables? Next, was the measures valid for the health condition that you were researching? Then we look at the results. Were they significant? Next, we also look at the demographics of the people in it. Were they of similar age, height, weight, percent body fat? Next, we also want to make sure that those characteristics, age, height, gender, are all similar across the groups. Because if not, then one group can have an advantage. It will skew the results. And then by skewing the results, we come up with faulty conclusions and recommendations. And the big thing are the subjects generalizable to your patient, which means that the patients in that study are similar to the ones that you are treating. And an example of that would be looking at a study that consists of all military personnel. And you treat outpatient and none of them are military. So would the results of that study about a particular intervention be practical for you? No, because it's not the same type of patients. Next is, was the correct statistical test ran? Was it the ANOVA is the test that was run, but it should have been a chi-square test? Or that it was a correlational test, but you didn't run it. So you look at the type of statistics that was used as related to the problem that they're trying to solve. Were the results presented in the paper? Were the results statistically significant, and how large is the difference between groups? Which means that if the differences were statistically significant, but the difference was small, or a small confidence interval, then what that shows is that there's not really a big difference between a control group and a treatment group. Next is that sometimes the results are not significant, but the authors will say that it is. So you got to be careful about that. They may say that if we had more subjects, that we could have possibly obtained statistical significance, or it was trending that way. Some final questions that you should be looking at here, again, is that are the results actually significant? Just because the authors say they are, you need to do your homework. You need to find out how those statistics were derived. What formulas did they use? Were they the correct formulas? Because, as you know, any data can be manipulated to answer any question that you want. So that's why we critically appraise the literature and look at all the aspects of it to make sure that the conclusions are based on sound statistics. Also, did the authors acknowledge limitations, such as not a big enough group, or the study didn't go long enough? And the other thing you got to look at is conflict of interest. Were they paid by a certain company to test some equipment and they found out that it was great? Well, you're going to find out it's great because they paid you. This is the strength of recommendation portion of the SORT. And here, this is where the recommendations come out of particularly out of systematic reviews. And to show you how this works, this is a piece taken out of the NATA position statement on concussions. And here on number 10, it talks about athletes at high risk of concussion should undergo baseline examination before a competitive season. Well, they looked at 3 studies that are listed here, and that the 3 studies all agreed that baseline data should be done prior to the season. However, that these studies weren't at the very top of that pyramid, but they were close enough. So using the sort, they were given a strength of recommendation of a B. And that's how using the strength of recommendation based on the body of evidence is done with that portion of the sort. That's a brief overview of the sort used for critically appraising the literature. Now, what I wanted you to do, you have 2 assignments to do. The one on the left is the summary that you're going to do on the sort and its application for critically appraising reviewed journaled articles and how it interrelates to the evidence-based practice. That assignment is due next week. Look at the rubric in the appendix 3. The other assignment is to give you practice at actually performing a critical appraisal. And what I want you to do is to find an article, use the sort, and appraise that article. And what we'll do is it's due at the end of the week, and you're going to turn it in, and then I'm going to give it to a peer in the class, and they're going to use the rubric to grade it. And so you'll be getting someone else's, you're going to change and grade someone else's paper. And from this, you're not going to get a grade for, say, you'll get a grade, but it won't be in the record book. But this tells me, 1, if you understand how to critically appraise an article. 2, it will also give me feedback on where we need to go work on. And we'll also do some assignments in class as well. Because I think it's important. It's an important tool that we need to use to determine what treatments are best for our patients. And it's the essence of the evidence-based practice. What I want you to do now is to stop the video and to write down some key points of the video. And at the same time, I also would like you to write down muddy points, things that were not clear. The muddy points you're going to email to me so that I can compile them and present and go over them, the areas that we need to work on, things that we're not sure about. So go ahead and stop the video and do that task. Okay, now the key points you should have got out of this screencast is 1, that evidence-based practice is the integration of best research along with the expertise of healthcare provider and patient value. That healthcare professionals critically appraise peer review articles to facilitate evidence-based practice. There's different type of tools. We use the sort, strength of recommendation taxonomy, and there's also the Oxford level of evidence. Another key point of this screencast is that the highest level of evidence is a systematic review, and that's the first thing that we should try to look for when we're trying to look at an intervention for our patient. And next is that the sort is used by professional organizations such as the NATA to develop position statements. So that wraps up the screencast for our introductory to the sort. Thank you very much. And again, I look forward to your muddy points so that we can work on getting better at critically appraising the journal articles. Thank you.